Hello everyone. Now we shall discuss the hot topic, that is monkeypox. Monkeypox. Monkeypox is a zoonotic disease. That is, it is transmitted from animals to humans. So it is a zoonosis. Monkeypox is a zoonosis. The lesions of monkeypox are similar to that of smallpox, but the monkeypox is less transmissible as compared to smallpox. It is less transmissible, and also it has low mortality as compared to smallpox. So the monkeypox is a zoonotic disease. The lesions look alike smallpox, but the monkeypox is less transmissible and has low mortality. The outbreak started on May 13th, 2022. So this year the outbreak started in the African countries on May 13th, 2022. The monkeypox belongs to the family Poxviridae. Poxviridae under the genus Arthropox. Under the genus Arthropox, there are several species. The most important one are the variola, vaccinia, cowpox, and monkeypox. So the monkeypox comes under the genus Arthropox and the family Poxviridae. Okay. Now coming to the structure of monkeypox virus. It has an outer envelope. With spikes. The inner core has nucleosome, that is, the nucleosome is made up of dsDNA along with some nucleolar proteins with lateral bodies on either side of the nucleosome. These are the lateral bodies. This is the outer envelope. So this is the basic structure of the monkeypox virus. Now coming to transmission of monkeypox virus. The monkeypox virus, the primary host of monkeypox virus is rodents and squirrels. Rodents and squirrels are the primary host for the monkeypox virus. The incidental host is the monkey. So man acquire infection from these animals through bushmeat hunting. That is, when the man goes for hunting and eats the flesh of the wild animals which are exposed to these animals, then the man acquires infection. Or the other way is when there is direct exposure to body fluids. When man has direct exposure to body fluids of these animals, then the infection is transmitted from the infected human the disease is transmitted to other human through droplet mode or through direct contact to skin lesions. Vertical transmission from mother to fetus is also reported. Now coming to clinical presentation. The incubation period is 5 to 21 days. After this incubation period of 5 to 21 days, the patient starts experiencing the symptoms. The first phase is febrile stage. In this febrile stage, the febrile stage lasts for 1 to 4 days. The patient experiences symptoms like fever, myalgias, backache, lymphadenopathy, headache, and malaise. Then after the febrile stage, patient go into rash stage, which lasts for about 2 to 4 weeks duration. In this rash stage, patient have macules, which progresses to papules, and then vesicles. On these vesicles, there will be umbilication. Umbilication will be developed over the vesicles. Then these vesicles starts transforming into the pustules, then pustules to scab or crust. So this whole process takes about 2 to 4 weeks to develop. When the crust starts falling off, when crust falls off, the transmission of infection is less likely. The transmission of infection is less likely. Lesions involves particularly the hands, face, soles, palms. The lesions of this small monkeypox should be differentiated from that of the chickenpox. So, monkeypox lesions, how to differentiate from that of the chickenpox. In chickenpox, there is pleomorphic type of rash. Pleomorphic rash. That is, all the lesions are in various stages. But in monkeypox, all lesions are in same stage. That is, all will be either macules, or all will be either papules, or all will be either vesicles. The lesions will be in same stage. Okay, there is lymphadenopathy in case of monkeypox, but in case of chickenpox, the lymphadenopathy is rare. The lymphadenopathy is rare in case of chickenpox, but in monkeypox it is commonly seen. Mostly the cervical lymph nodes are enlarged in case of the monkeypox virus infection. Okay, the infection evolution of rash is fast in case of chickenpox. Evolution of rash is fast. Here, evolution is slow. And distribution of rash is, as previously discussed, in case of monkeypox, the distribution of rash will be face, limbs, palms, soles. But here, predominantly trunk. On the trunk, we see the chickenpox lesions predominantly. Now coming to complications. Complications in monkeypox infection. The first one is blindness can occur when there is eye involvement. Blindness when eye gets involved. The second complication is due to sepsis, the patient will have multi-organ dysfunction. The patient may land up into MODS. The third complication is bronchopneumonia. The fourth complication is dehydration. the last complication is encephalitis. So these are all the major complications seen with the monkeypox infection. Now coming to diagnosis of monkeypox. How to diagnose the monkeypox? The diagnosis is made at the National Institute of Virology, which is situated in the Pune. Here the diagnosis is made through PCR, polymerase chain reaction, or nucleic acid amplification test. Okay. The specimens required for PCR are skin lesions, particularly the roof of the lesion is taken. Roof of lesion is taken. Suppose this is the lesion, the roof is sliced with the scalpel and sent for PCR analysis. The other specimen could be vesicular lesion. Vesicular swab is taken. Then crust can also be used as specimen for PCR. At least 2 lesions should be taken for PCR analysis. Now coming to treatment. Treatment of monkeypox. As it is a self-limited infection, conservative management is sufficient. We have to treat the dehydration part, and we have to treat the complications. The drugs which could be useful are tecovirimat, which inhibits p37 nuclear protein, and brincidofovir. These are the 2 drugs which could be useful. Now coming to vaccination. Dryvax. It is a old vaccine prepared from vaccinia virus. It is a old vaccine, not used now. The other vaccines are ACAM 2000, and other one is Ginos vaccine. ACAM 2000 is a replication competent vaccinia virus. ACAM 2000 is prepared from replication competent vaccinia virus, whereas Ginos vaccine is prepared from replication deficient vaccinia virus. This has poor safety. ACAM 2000 has poor safety profile, cannot be used in immunocompromised patients, whereas Ginos vaccine has excellent safety profile and it can be used in immunocompromised. In immunocompromised also, Ginos vaccine can be useful. After ACAM administration, there can be take. Take occurs after ACAM 2000 administration. Take means after the administration of this vaccine, there is development of skin lesions at infected site, vaccinated site. The take does not occur in case of Ginos administration. The take do not occur in Ginos administration. Then here in ACAM 2000 vaccine, it is administered as single dose, multiple percutaneous punctures. Single dose with multiple percutaneous punctures with bifid needle. Here in Ginos vaccine, the route of administration is subcutaneous, 2 doses, 4 weeks apart. 4 weeks apart. Now coming to post-exposure prophylaxis. When a person is exposed to monkeypox virus, he should have vaccination within 4 days, ideally within 4 days, but vaccine can be administered within 14 days. If the person has administered vaccine within 4 days after the exposure, the person has less likely to acquire infection. If the patient takes vaccine within 14 days of exposure, then if the patient acquires disease also, then it would be less in severity. Prevention. Apart from vaccination, we have to isolate the infected person. And we have to cover the lesions of the infected person with a sterile cloth. Cover the lesions over the patient with a sterile cloth. Provide face mask to the patient. As it has droplet mode of transmission, provide face mask to the patient. Healthcare workers should follow strict precautions and have to wear PPE, personal protective equipment. So these are all the major aspects of monkeypox.